Not able to start. Hello.
Hello.
I hope you all can hear me. So let's
Yes.
start, Dr. Sharma.
Okay.
Good
So I'm
evening.
seeing people in great numbers attending these webinars. So thank you to one and all, especially to those who have logged in way before time and have waited patiently for us. Thank you very much for trusting this process. So welcome one and all to this fourth webinar that we are hosting. And it gives me great pleasure to introduce Dr. Tariq Jagmag. He's actually more of my friend than and what do you say, I can speak to him with freely, clearly, and just unload my things onto him. He's always there to help me out. So other than that, as a great person and a very jolly guy, I think he has the greatest humor that I know. Other than that, he's a genius, a person with 2 patents. He has many peer reviewed scientific based publications in journals, in international journals. He is a specialist in psychoneuroimmunology, endocrinology, and a scientific and in scientific based homeopathy. So before I begin, I actually saw a lot of names which are repeat in almost every webinar that we take. So I would like to acknowledge and thank those people for attending every webinar that we host. This itself shows that you trust this process and this knowledge that Dr. Tariq Jagmag is imparting to us. Also, some of them have joined his course. So thank you, because just with one person, we can't make much of a change. But if we have many more helping hands, I'm sure with Dr. Tariq Jagmag's knowledge, we can reach a larger mass. So over to you, Dr. Tariq, and welcome everyone once again.
Thanks a lot. So I'll just put myself on share screen so I can write as I talk. I think that's the best way to go about it. All right. So the entire topic of this webinar is anxiety and sleep disorders. And what I'd like to talk about is actually the gut-brain axis in this. So the point is that we've all heard loosely of the term leaky gut, right? Most of us know the term leaky gut. And whenever we are stressed, stress actually induces your gut to become more leaky. And as we develop leaky guts, we get all kinds of autoimmune disorders, sleep disorders, etc., etc. So the point of this webinar is to broadly define anxiety as a etiological factor, and to explain how it causes leaky gut and how that leaky gut then can make you obese. It can cause you migraines, it can cause you autoimmune disorders, etc., etc., and then how to go about treating it. So let's start by looking at anxiety and how does anxiety come into our bodies. So let's write this word down, anxiety. And it could have two separate sources. One is extrinsic sources, which means that you are stressed due to certain things in your house happening, or maybe some work stress happening, or having some issues with your girlfriend or your boyfriend or your marriage. These are causing you the kinds of extrinsic stressors which are affecting you, and that's making you stressed out. The other factors that can cause anxiety are intrinsic factors. These intrinsic factors are coming from within your body. So what we have seen in many patients with anxiety, when we get their stool test done or their urine test done, we find that they have infections. And after we treat their infections out, the anxiety levels drop. Or they have fungal infections in their body. So the intrinsic factors are basically almost always infections, which could be either bacterial infections, it could be viral infections. Like even after COVID, there are many patients who face depression bouts because of that viral persistence which causes inflammation. And the last one is leaky gut. Now these extrinsic factors which are coming from work stress and things like that, those you can really help by things like meditation, or you can use theta brain activation with sort of chanting, or using some sort of sound entrainment technology. Using all these things, you could help extrinsic stressors reduce. But when you have intrinsic stressors inside your system, which are bacterial, viral, fungal, or leaky gut, even after you do all these activities, whether you do yoga or meditation, you're still going to feel that stress in your body. Okay? And this is what I want to focus my talk on these intrinsic factors and how to go about treating them, and also how to recognize that these things are happening inside your body. So I'll start with a simple example. We had a young boy who was around 20 to 21 years old. All of a sudden, he developed acute anxiety pangs and he developed suicidal ideation. After many weeks of him becoming from bad to worse, his parents contacted me and I said, well, let's just run a urine and a stool examination to see if there are any infections causing it, because the problem came from nowhere. He didn't have any such issues. And when we did the examination of his urine and stool, we found he had a Klebsiella infection as well as an E. coli infection. So the parents took the test report to many doctors and they said, well, there's no connection between having a UTI and having a mental disorder. So they refused to treat him for the infection. After some time of hospitalization, trying to treat his mental dysfunction, when nothing worked, the parents got him to me. And I simply gave him antibiotics to treat that Klebsiella and E. coli. Within the first dose of the antibiotics, the child completely calmed down. And by the end of the week, he was no longer having any anxiety, no longer having any schizophrenia, no longer having any suicidal ideation. It was almost magical to watch. After that, I wrote a published paper. It's a peer-reviewed published paper in an international journal on this case, where I clearly showed the mechanisms by which these infections can lead to anxiety and stress disorders. So if you're anxious constantly, all right, make sure that you have a stool and a urine examination done to rule out any infections. Also, rule out any fungal infections. Chronic fungal infections either affecting your nails, or you have dandruff in your hair, or you have a white coating on your tongue. Any of these things can cause you anxiety. So that's about infections. Besides infections, there's diabetes that can cause you anxiety, because as your blood sugar moves up and down, of course, it's going to make you anxious. We've all experienced when we are hungry how hangry we get, because we are angry at the same time. So as your blood sugar moves up and down, you can become very angry, and that can cause you anxiety and stress. So before you become diabetic, your blood sugar will actually start to drop as your insulin levels rise. So before you actually turn diabetic, you will become hypoglycemic. You'll start having sugar pangs. Okay? So you start craving for sugar, and you'll think, why am I developing a sweet tooth all of a sudden? It's because your blood sugar is dropping since you're pre-diabetic. So infections and diabetes both can cause you anxiety. High blood pressure also can cause you anxiety, which is why when an anxious person goes to a doctor, the first thing they do is they check your blood pressure. So if you're constantly anxious, you're constantly angry, make sure that you check your blood pressure and your blood sugar. Now we go to the main topic, which is leaky gut and how to identify it. If there are any questions during the entire series, you can just stop and just ask me. Okay? You can just ask the question in the chat box. I'll look at it and answer. Yeah, so you don't have to wait up till the end to ask me a question. Let's look at leaky gut. I suppose most of you all must have heard of this word, right? Leaky gut. And what does it mean? It just means that your gut has become kind of leaky, and the toxins in your gut are now leaking into your bloodstream, and your immune system is activating against them. So let's look at what are the symptoms of leaky gut. And if I ask these questions, if any one of you has these symptoms, please say yes in the chat box so that we know that you have them. One of the most common symptoms that a person has is milk and gluten intolerance. After eating gluten, or if they drink milk, all of a sudden they find that they're not able to get sleep in the night. Or if they have, and they also develop lots of bloating and gas after eating gluten and milk. Or in the night, if they have a lot of sugary food, in the night they don't get sleep. They have alcohol intolerance. They're not able to drink alcohol. You're not going to be able to take painkillers. The moment you take painkillers, you'll find that your symptoms start to flare up, your stomach starts to bloat up. You start having migraines, you start having headaches all the time. The headaches are persistent and they last for a very, very long period of time. You wake up in the morning and all your joints are painful. Your joints are painful in the morning when you wake up. As the day progresses, you start feeling better. You start retaining water inside your body. Water retention is an issue. You'll tell your doctor that I'm eating very little, but I'm gaining weight because there's fluid building up inside my body. You develop Hashimoto's hypothyroiditis. You develop hypothyroidism. You develop rheumatoid arthritis, osteoarthritis, ankylosing spondylitis. All of these autoimmune disorders, all of them come from leaky gut. Okay? So if any one of y'all has experienced all these symptoms, or even one of them, what you are clearly having is leaky gut symptoms. Okay? Now, why does leaky gut happen? So the causes are basically very simple. I'm just going to write them down as an anagram. YT. So N basically stands for NSAIDs. NSAIDs are painkillers like diclofenac, paracetamol. All these painkillers that you're taking, let's say you have chronic osteoarthritis and you're taking a lot of these painkillers every day. These painkillers will trigger leaky gut inside your system. As the toxins of the bacteria leak into your blood, your immune system attacks them and you get inflamed. One of the markers that you can use to check if you have leaky gut is look at your CRP, look at your ESR. They would be persistently elevated. If these are there, that means you definitely have leaky gut affecting your system. Look at your uric acid. You will have elevation in your uric acid levels as well. It's one of the features of leaky gut, and I'll explain why these are happening as we go ahead. So the first thing is too many painkillers. Now, how many is too many? So if you give a rat, say a paracetamol every day for around 20 days, within 20 days, that rat can develop leaky gut and can get inflamed. So it's just 20 days, one pill of paracetamol every day, that itself can cause you leaky gut. Patients are taking so many painkillers, sometimes twice, thrice a day for their entire life because they're having some other chronic pain disorder. And the chronic pain disorder may simply be happening because of leaky gut. And then they're making the gut even more leaky by taking more painkillers. Okay? So painkillers is one very important factor. Next is stress. So in a lab, how do we induce leaky gut in a rat? We simply heat stress the rat. So we put the rat in a hot environment every day. And within a week, the rat will develop leaky gut. So even heat or cold can induce leaky gut in you. Now you're thinking, why is your body so stupid, with a little bit of heat and cold, it's inducing leaky gut? The reason is because when your body is stressed, your immune system thinks that there is an attack happening. So the gut starts to leak so that your immune system can understand what is inside your gut and attack it if it becomes pathogenic. So your immune system is getting prepared in the face of threat, and that's why it's making your gut leaky. So just imagine that heat and thermal stress can lead to leaky gut. When you have emotional stress, it makes it worse. And this is not emotional stress over 10 or 20 days. This is emotional stress which is chronic. So chronic emotional stress is going to deplete your blood cortisol levels. As your blood cortisol levels drop, you start finding that your blood pressure starts to drop. You start feeling weak. You start feeling fatigued all the time. You start having sugar cravings again because your cortisol has dropped. Okay? So for all these things are involved in chronic stress. So any form of chronic stress, which is around 20, 30 days in duration, that's how long I'm saying about chronic stress, is going to cause you problems. So stress. Then comes alcohol. Alcohol really induces leaky gut very strongly. So if you're having a sip of wine every day, not a problem. But you start drinking heavily and you start having glasses and glasses of alcohol every day, that's definitely going to lead to leaky gut. Okay. In patients who are alcoholics, if you've noticed, if they stop drinking alcohol, they don't have any sleep, they start having insomnia. The alcohol has already started causing the leaky gut, and the leaky gut is now causing insomnia. But when they have alcohol, it kind of numbs the brain off, and in spite of having the leaky gut, they're able to sleep. So in alcoholics, the reason why they drink alcohol is to induce sleep. And once you treat the leaky gut, they start sleeping better and they're able to withdraw the alcohol. Then we come to I, which stands for inflammation. Anytime you're having persistent inflammation, for example, you're having arthritis or you're having osteoarthritis or rheumatoid arthritis, or you've just been through cardiac surgery. Even after cardiac surgery, you can develop leaky gut because of the stress and the inflammation that comes after it. Or you've had a burn on your body, or you've got some injury done, so you've injured yourself in some fracture. All of these things create an inflammatory state which can aggravate or worsen leaky gut, even initiate leaky gut. Then comes to D, deficiencies. Deficiencies of vitamin D, omega-3, zinc, and vitamin A. All of these, when they are very low, can initiate leaky gut. That doesn't mean you keep dosing on vitamin D and get it to some absurd high number of 100 or 200 or whatever it is. If your vitamin D is low, you can simply dose of around 5,000 to 6,000 IU per day, and that is your daily required dose. You don't need to dose with some crazy amounts. Just the minimum requirement, which is around 6,000 international units a day, which will be sufficient. If your omega-3 is low, you will notice that your fingernails, the bed of your fingernails, that becomes rough and starts to peel off. So if you start having rough fingernail beds and you start seeing all your skin getting peeled off from here, that means your omega-3 is usually low and you need to take some omega-3. In terms of zinc, if your zinc levels are low, what you'll find is you have chronic lack of taste. So you will need to put more salt in your diet to get that taste. So you'll keep asking for salt, you'll keep asking for more flavor in your food. You'll not be able to eat salads that easily because you'll have no taste in your mouth. And vitamin E being low, of course, you will have problems in night vision. Last bit is sugar. So if you start to sugar load your body, take a lot of fructose, take a lot of Tropicana, take a lot of Coke, take a lot of Pepsi. These are high fructose drinks. The more you have them, the more worse your leaky gut becomes. Which is why patients who have leaky gut, if they have sugar in the night before they go to sleep, they are not able to sleep in the night. They have frequent bouts of waking up, or they're just not able to even initiate sleep. Then comes Y, which is yeast infections. So chronic fungal infections in the gut, which can cause you an itchy bum at times. You eat sugar and your bum starts itching. That's usually a yeast infection. You can have dandruff in your hair. You can have your nails can become rough as you start getting fungal on your nails. Okay, or you can get some chronic fungal infection in your groin. All of these can trigger leaky gut. Last one is toxins. T stands for toxins. So toxins are things like your atmospheric pollution that you're taking in every day, which has lead, cadmium, arsenic. All these toxins enter your body and can trigger leaky gut. Okay. How do you remove these toxins? You can use things like EDTA to help remove these toxins, DMSA to remove mercury out, or you can even take things like spirulina or apple pectin. It's called as apple pectin, to help to remove these toxins out. How do you know that you have toxins in your body? One very important thing that any of these toxins do is they start causing problems with your skin, because these toxins are usually stored in fat. And when you have too many of these toxins, they start discoloring your skin. So you start having a lot of skin discoloration. You notice that when you go out in the sun, you start getting tanned very easily. These are some of the initial symptoms of toxins entering inside your blood, which is why you'll notice when you go to a cleaner atmosphere and you move away from the city, you're no longer going to get tanned that badly and your skin tends to improve. Pollution damage can be very damaging to your skin. Let me take some questions if there are.
There are 3 questions actually.
Yeah, so why does alcohol cause sleep disorders? Yeah, so because it is triggering leaky gut, and when your gut leaks, the toxins from your gut leak out into your bloodstream, your immune system attacks it. It attacks it attacks your brain as well, which is why you can't sleep if you start withdrawing off from alcohol. Okay, because the alcohol is acting like a calming agent to your brain, while at the same time it is aggravating your leaky gut and inflaming your body. I will talk about the testing as well. So I'll just finish off this and then I'll go to the testing. Okay, so there are 2 other questions. The first question is, can low levels of estrogen for postmenopausal women cause insomnia? Yes, it can. So what we usually do to up your estrogen levels is we use a low dose medication of mine called as folliculinum. If you're from Indonesia, you can contact Amanda for it. It will slowly bring your estrogen levels up. The next question is, how many types of sleep disorders, doctor, whether sleep disorder can make problem dangerous for health? Yeah, so sleep disorders I'll get into. I'm just talking about anxiety first. Okay, so this is your little thing about why leaky gut happens. Now we go to what is the testing for leaky gut? So what we do is we test for something known as zonulins. We look at zonulin levels in the stool. This is the most accurate test for leaky gut. I'll explain what a zonulin is when I explain what we've developed to treat this leaky gut. So this is just called the zonulin stools test. You get a stool sample of a patient and you check the expression of the protein zonulin in the stool. The higher the zonulin level, the more severe the leaky gut is. The lower the level, the better it is for you. Now, what is the medication that you're using to treat this? And this will really blow your mind as to how simple it is. What we're doing to treat it is we're using curcumin. But this is not your things like your nanocurcumin or your liposomal curcumin. What we're using is water-soluble curcumin, which is complex to zinc. Okay. Now, why is this helping with leaky gut? And why did they say normal curcumin doesn't work? So, before I start explaining this, I want to explain what this curcumin or the soluble curcumin with complex zinc does inside your gut. And then I'll be able to explain why normal curcumin may not really work for you. Okay, so for me to explain this, let's look at what are the defenses your gut uses in order to defend itself from getting inflamed out. So let's imagine this is your gut, okay, and you have these intestinal epithelial cells here. These are the cells which are lining your gut, and these are the enterocytes which are absorbing all the food and nutrition. Now, most of these cells have some leakiness to them. They have these pore channels through which some amount of bacteria is, of course, taken up by your immune system. So this is your immune system below it with your bloodstream and the whole thing. So you have all these immune cells floating around below the gut. And some of these bacteria are tasted because your immune system wants to know if there's something toxic or not. So it keeps tasting those bacterial toxins and some of the bacteria. So a little bit of leaky gut is there. But how does the gut protect itself from getting hit by a whole bunch of bacteria? The first thing is that these cells secrete something known as intestinal alkaline phosphatase. What this intestinal alkaline phosphatase does, it's not your liver alkaline phosphatase, keep that in mind. This is your intestinal alkaline phosphatase. So what this alkaline phosphatase does, since it's a phosphatase, it breaks the LPS of the bacteria. It breaks the phosphate bonds and makes the LPS non-toxic. LPS is basically something secreted by your bacteria which causes you damage. Because of course the bacteria want to spread in your body, so they secrete this LPS to cause you damage so they can spread. So they secrete this thing known as LPS or lipopolysaccharide, and this phosphatase helps to break it up. Now this curcumin helps to increase the levels of alkaline phosphatase, helping to break some of their LPS down. The next defense that your intestinal epithelial cells have is they have a lot of mucus. They secrete this mucus. This is the mucus on top of the intestinal epithelial cells which holds the bacteria together and stops those bacteria from hitting the brushed border of the intestinal cells. This is the brushed border. So the mucus is holding the bacteria and is constantly removing the bacteria out. When you give curcumin, you increase the amount of mucus produced and you make the mucus more acidic. By making it more acidic, you kill those pathogenic bacteria off. So curcumin does this as well. The next thing it does is it increases the secretion and the life of a Paneth cell. A Paneth cell is a cell which is in your intestine. And this guy secretes defensins. They are called as alpha and beta defensins. These are part of your innate immune system. And when the bacteria start to attack, these planet cells start to secrete the defenses. They go and bind to the bacteria and destroy them. If the planet cells are in poor number, the bacteria will not be killed, and this third line of defense also will be compromised. The last line of defense your intestinal epithelial cells have against a bacterial onslaught is to increase the expression of occludins. Occludins are these proteins which are translated in the cell, and then they go here and they form a tight junction over here. And they occlude the cell together. And zonulins are the proteins which your cell makes when it says that, I think I'm going to surrender. I can't hold this junction intact anymore. It starts making zonulins and opens itself up. As the cell opens the gap between it up, the bacterial toxins have a free entry into your immune system. So why does the cell do that? It opens itself up because it says, look, if I don't open the junction up between me and my friend, these toxins are going to destroy me and my friend. So let me just open up and let somebody else deal with them. So then it starts making these zonulins. And it is these zonulins which we test for in the stool. Okay. Now, why do these patients who have these problems get food sensitivities, have gluten allergies? Because gluten is only partially digested in your body. So all of us only partially digest gluten. So that undigested gluten starts to leak out. And as it leaks out between this gap, it starts causing you immune reactions. Okay. Now, why is it that this curcumin is zinc complex, and why do we need to solubilize curcumin? So firstly, let's look at where curcumin comes from. It comes from your normal spice, which we call as turmeric, right? We all know, we've all heard of turmeric lattes, which are being given all over the world now as a healthy drink. Curcumin is only about 2 to 8% inside haldi. So it's an extract out of your normal haldi or normal turmeric. This curcumin is not water soluble. This is the biggest problem, that it's not a water soluble agent. Only if it is water soluble will it be able to enter inside your intestinal epithelial cells. What happens if you make nanocurcumin? So there's so many formulations saying, oh, we have made nanocurcumin. Okay, great. You've made the nanocurcumin, you've added piperine to it in order to improve absorption. But that piperine that is added aggravates your intestinal epithelial cells and worsens the inflammation in the gut. Plus the nanocurcumin, even if it's nano, will not enter inside your intestinal epithelial cell. Let's see what a little bit of research done on this topic shows. So if you're taking curcumin, you will require around 440 milligram per kg weight of your body for that curcumin to enter inside your intestinal epithelial cell. That means if you're around 60 kilos, you require around 25 grams of curcumin to be taken twice a day for it to enter inside the cell. If you make it water soluble and you complex it to zinc, the cell has zinc finger proteins which suck that curcumin inside. If you do that, you require only 25 milligram of that curcumin, which means you require only 1.5 grams taken twice a day in order to heal your leaky gut. Let's say you don't have this, okay, and you don't have my product and you still want to help yourself heal your leaky gut. All you do is you take your normal curcumin that you have. So you take around 2 grams of your curcumin. Okay, don't use haldi, get curcumin, which is the extract. Make sure it doesn't have any piperine to it because the piperine is going to aggravate you. And add around 10% or around 20 milligram of zinc in the form of a gluconate. Why am I saying to use gluconate? Don't use zinc oxide, don't use zinc sulfate, because these salts are very difficult to absorb inside your cell. So you need around 20 milligram of zinc gluconate with around 2 grams of curcumin to at least show you that effect in your gut. And trust me, when you start taking this, you will automatically find your bloating, your gas, your IBS symptoms reduce. I've had patients when I give them my dose of my cursing to them, within less than 10 minutes, their chronic migraines have gone, their joint pains have gone. It is literally amazing to see it in front of the patient. We had a case who had chronic sneezing, who was having chronic allergic rhinitis. She also had gluten sensitivity, which made me think that she has leaky gut. And when she came to my office, in front of her, I gave a few drops of my cursing to her, and less than 5 minutes, the allergy and the rhinitis and the sneezing completely stopped. It works very, very fast as long as you make sure that the curcumin is at least solubilized. If it's not solubilized, add zinc gluconate to it and take it so that it works better. Okay? And that's as simple as it is. People have struggled for so many years trying to heal leaky gut. And there's so many things which are said, you give glycine, you do this, you do that. There's nothing you got to do. You just have to give this curcumin and zinc complex together and your leaky gut will heal. You'll see your CRPs coming down, your ESR levels coming down, the water retention in your body going, fatigue will go, your sleep starts to improve dramatically. Okay? So just with this, you can do it, and it's as simple as doing that. So let me write this again. So you need to use curcumin. If you want, use nanocurcumin. Don't use liposomal curcumin because it's not going to get absorbed by your intestinal epithelial cells. So if you really have to use nanocurcumin, make sure there's no piperine in it and add it to 10% zinc gluconate. Okay, how many? This will be around 25 milligram per kg. So if you're around 60 kgs in weight, you're going to require around 1.5 grams. Okay, twice a day. So take both of these together. What we are doing is we are complexing the zinc in the ionic form. So it's like ionic zinc, which is complex to the water-soluble curcumin, which makes it directly enter inside the epithelial cell. Why do you require it to enter the intestinal epithelial cell? Because the intestinal epithelial cell is manufacturing that alkaline phosphatase, and for it to do that, it needs to translate proteins which can do it. So in order to undergo protein translation of not only alkaline phosphatase, but also mucus and also the occludin proteins, you need the curcumin to enter that cell. This is why, if you're taking normal curcumin from the store, you're taking 2 grams of curcumin, it's not working for you because it's not complex to the zinc, which is pulling that curcumin inside. Let me see if there are any questions. Yeah, so there's one question on PTSD. I'm getting to all these things. Yes, I'm going to answer these questions. Okay. Let me see if there are any other questions. How do you have the, okay. So there are a lot of other questions which are there. I'm going to try to answer them, but some of them don't fit into this particular webinar format, but I'm still going to try to answer them. Okay. So now that you have at least understood that this is something simple you can do, let me talk about a few of the cases that I have done with this. For every case that you get of leaky gut, first thing is look at the factors that could be causing them the leaky gut, which I said about NSAIDs and the extra YT. Look at it, look if they have IBS like symptoms, bloating, gas. If these symptoms are there, stomach pains, water retention, migraines, food sensitivity, any food they eat causes them a rash or causes them reactions. This is a case of leaky gut. We had a case I think last week, where the patient came with asthma, severe asthma, and this patient's IgE was over 8,000. It was very, very high, and she was gasping for breath. After the Zinc was given to her, within like 24 hours, she was able to breathe without taking her inhaler, and her fatigue had gone. She again had food sensitivities to gluten and milk. So look at food sensitivities very carefully. If they are there, make sure that you give the curcumin and the zinc to your cases. If you also have it, make sure you take it. Recurrent migraines again are a very strong indicator that you're going to require zinc. So this is just about the anxiety which is caused by leaky gut and infections. Let's go to the other features of anxiety, and then we go to sleep. So you are stressed with something coming in, someone has died in your house, or you've had COVID stress, or you've lost a job, or you've lost a partner. How do you go about treating these things for yourself, and how do you understand what is going on in your body? So let's look at firstly the hormones which are involved in anxiety. You have dopamine, there's GABA, there is serotonin, there is endorphin. These are the 4 major hormones that you're going to work around with as you try to treat your anxiety from extrinsic factors. Endorphin, let's start with this endorphin. So you guys have heard of endorphins. If you're having their feel-good hormones, they're like your natural marijuana. So instead of smoking or a joint, your body can actually make you the same hormones, which are called as endorphins. They give you a good, happy feeling. Now, these endorphins, when they are low, and when you want to increase them, you will have a craving for eating spicy food. So there's this craving for spice, because spicy food helps to release endorphins. Alcoholics, okay, who drink alcohol, if you've always seen them, they always want to eat spicy nuts with the alcohol, because the kick that you get from the alcohol increases when there are more endorphins in your body. So in order to increase the endorphin levels, the alcoholic will always have those spicy nuts. I very rarely seen an alcoholic eating a healthy salad along with the alcohol, because they need endorphins to come in, and that's why they want spicy chicken wings, spicy nuts. So it's the spice that they crave for. So if you're craving for some spice in your life, remember that your endorphin levels will be low. How do you fix it? We have a low dose endorphin that can be given to you, which will really help you fix those endorphins. Another medication that can help you is a homeopathic called staphysagria. So this staphysagria is a homeopathic which can trigger your endorphin levels. Okay. So staphysagria 1 m potency, maybe just take 2 drops once a day, and you start feeling quite happy. So patient who requires staphysagria is one who usually has held on to a lot of abuse in their life. So the husband is shouting at them, or the mother-in-law is shouting at them constantly, and they've taken all that abuse in and they don't really express it until one day they explode with anger. So that's your endorphin, because you're lacking endorphin, you don't have that exuberance to express. So you keep allowing the abuse to come in, and then one day you just blast out. So craving for spice means that your endorphins are low. Then about serotonin. We've heard about these hormones called as serotonin. So people are taking 5-HTP supplements. They are known as 5-hydroxytryptophan. They take these supplements along with melatonin in the hopes that their serotonin levels will go up. But it's a very bad strategy to do that. And this is why 5-HTP tablets and pills have been banned in countries like UK. And even in many Western countries in Europe, 5-HTP is not sold over the counter. Why does this happen? Because the levels of serotonin and dopamine are usually in a balanced state. If you take a precursor of serotonin, which is 5-HTP, you can drive your dopamine levels down, which can actually cause you a clinical deficiency of serotonin, even though you're taking so much of it. So many patients who take 5-HTP actually get worse after taking it. So you should not be taking 5-HTP or high doses of melatonin. Anything more than like 3.3 mg or 0.5 mg of melatonin is not going to do you any further good. Okay. So how do you know that your serotonin levels are low, and why do they decrease? Serotonin levels are usually low in women more than men, because in women, due to the menstrual cycle, the serotonin levels move up and down, since the release of serotonin is controlled by estrogen and by progesterone. So as the menstrual cycle moves, so do the levels of serotonin. The moment serotonin drops, okay, it can cause you anxious depression. So you will feel depressed, you'll feel like not doing anything, and at the same time, you start feeling anxious. On your gut, it affects very badly. It causes chronic constipation. Constipation that you feel with the low serotonin is a lack of urge to pass stool. So it's not constipation where your stool is hard. It'll just be a lack of urge. And when the levels are low, you also start having excessive thirst in the night. So if any one of you has to wake up in the night and start drinking lots of water, it's not in the day, but only in the night. Okay, that's your low serotonin. You start getting osteoporosis because your serotonin levels are low. All of these are features of low serotonin. And not only will it cause anxiety, it will also cause you insomnia. Then comes to GABA. GABA is the neurotransmitter which suppresses your glutamate. Glutamate makes you hyperactive, makes you excited. So when your GABA levels are low, you will no longer be able to calm yourself down. So this is a calming agent. If you calm yourself down, there's basically a lack of GABA, and the causes of that could be very high levels of glutamate, which can increase in bacterial infections. So make sure you check your urine and your stool. And if you have infections, treat them, and your GABA levels will go up to normal again. Dopamine is the hormone which helps you to create interest in doing activities. So in order to motivate you, your dopamine levels go high. If they go too high, you can end up even getting schizophrenia. But if your dopamine is low, you'll find lack of motivation. Now, how do we treat all these disorders? So someone asked me, what do I do for anxiety? So something very simple to do is we have one medication for anxiety, which is called as LSD. It has an LSD-like effect. It's a mood elevator. Anxiety decreases. So many doctors in our group have already used it for the treatment of anxiety and insomnia. So what I do usually in my practice is I combine LSD along with the curcumin and the zinc combination, which I call as cursing. When both of them are combined together, not only does the extrinsic stress decrease because of LSD, and the person becomes more social, they become more outgoing, they become more happy in life, they become more motivated to do things. And at the same time, the cursing is treating the leaky gut and decreasing inflammation, which was causing them anxiety and depression. So this is a combination that I use, just LSD and this together. The other thing that can make you anxious is your nervous system. So let's look at your nervous system. Your sympathetic nervous system, when you're attacked by some lion or a tiger or a bear, you're obviously going to have an increased sympathetic nervous system. Your heart is going to palpitate fast. So there was a person asking me, what do I do? I'm having heart palpitations. So because your sympathetic nervous system is in overdrive, you will start having bloating and burping as the SNS goes high. Why bloating and burping? Obviously, when you're running away from a lion, you're not digesting your food. It causes you chronic lack of food digestion, making you bloat and making you burp frequently. The way to treat this is a simple homeopathic called as lycopodium. So 1 ml and just about 2 drops once or twice a day, or 2 pills once or twice a day. That will slowly bring your SNS down. You start finding that you're much more calmer. Your palms will no longer sweat. If your SNS activity is high, you will have sweaty palms, okay? Because you're so anxious that your palms become sweaty. You will always have a higher heart rate than normal. Okay? You'll become very angry and very aggressive with people in your house. You'll keep fighting with everybody in your house. But once you leave your house, when you're in a new situation with new people, you'll be quite well mannered. So there's almost like a Jekyll and Hyde personality. When you're in the house, you'll become really mad and angry type. And when you're in the office, you'll be the apple of the office. You'll be very nicely mannered in your office. Because when you're in the house, your nervous system, which was trying to keep you up, suddenly crashes as you're trying to relax, and then you completely blow your brain out. But when you're in your office, the nervous system is still up and is prepping you to make sure that you behave properly. So high SNS can also cause you this. So these are some of the simple things that can cause you stress. Let's look at your hormones, ACTH. ACTH is a hormone that helps to secrete cortisol. And if the ACTH level is low, you will have lack of thirst in your body. So you'll be thirstless. You'll be like, I don't feel like drinking water nowadays. Okay? If your ACTH is low and you have lack of thirst, there's a homeopathic called as pulsatilla. Again, 1 ml, just about 2 drops once a day, will not only fix your thirst, but it will also decrease your anxiety and will make your sleep much better. So these are very, very simple things. If any one of you has any of these problems, you can simply use these medicines directly. You start finding yourself improve. Now, I had just mentioned about the cursing some time back and how it is helping the leaky gut. What we found is that when the leaky gut starts to heal, cortisol levels inside the gut start to increase. As the gut cortisol levels increase, it also increases the systemic cortisol levels. So you start feeling you know that your blood sugars are normal. You start becoming hangry. I mean, you stop becoming hangry. You're not angry and hungry at the same time anymore. You become more peaceful in your life. Your joint inflammation, all the inflammation in your body starts to go down. So all these things are really positive for your sleep and anxiety. Sleep disorders may not necessarily be only a lack of initiation of sleep or frequently waking up. You could also have breathing disorders where your breathing becomes stuck in the night. You could have sleep apnea, central sleep apnea. So in central sleep apnea, your brain center, which is supposed to recognize when there is low oxygen, that should directly send a message to your lungs in order and your diaphragm so that it expands and you keep breathing in the night. But if you have central sleep apnea, you may wake up in the night feeling choked up, or you may snore very violently. Now, this is usually because of obesity. So you may not have just central sleep apnea. You may also have non-central based, which is because of your thick neck. If your neck size is more than 42 and you're having snoring, it's just because you're obese. But if it's less than 42 and you're a skinny patient, you don't have any fungal infections in your nose, you can breathe clearly, there's no sinusitis, that means you clearly have central sleep apnea. What do you do for central sleep apnea? There's a medication called Grindelia. Again, you can take it as 1 ml. Again, maybe 2 drops once in the night. So at night. This will make your breathing much more smoother and will stop you from choking in the night. What about if you're obese and you're fat and because of your enlarged neck size, you're not able to breathe? Then you need to decrease your weight. How do you go about decreasing your weight? Again, cursing will play a very important role. I explain why. So when you take a rat and you inject LPS into its blood every day, the same amount that would happen with leaky gut, the rat starts to become obese and he starts to become diabetic. In fact, the origin of type 2 diabetes is simply leaky gut. So when you cursing is given, it will help you lose weight as well, and it will also help to heal your leaky gut. Besides this, we have another medication called Imucil. This is a NOX2 inhibitor. It was developed for COVID, but we found that it was helping patients decrease the abdominal fat. So as a NOX2 inhibitor, it's one of the best antioxidants that you can take. And as it decreases oxidative stress, your cells become less insulin resistant. I mean, they become less insulin. So they become less insulin resistant. They become more sensitive to insulin, and you start losing abdominal and neck fat. So these two things can really help you for that weight loss. Of course, there are many other types of insomnia as well, but I won't get into them. There are more than around 10 types of 10 variations of insomnia. But these are the major types. Now, let me try to recap this information again within a couple of minutes so that you can just reorient yourself to it. So let's relook at this again. Your anxiety and your sleep disorders, and your arthritic pains or your joint pains or your migraines or your bloating, they are coming in due to two factors. One is extrinsic, which you have no control over because you're stressed with work or stressed with something else. These factors you can manage by using yoga or using meditation or using sound therapy. These are some things that maybe you can manage. But when these things come in, they bring infections with them because your immune system is suppressed with chronic stress. As those infections come in, they can lead to further anxiety, further stress. So test yourself out for fungal infections, bacterial infections, viral infections. Make sure you're free of this if you're anxious. Secondly, chronic anxiety and chronic stress can lead to leaky gut. And then in a never-ending feedback loop, the leaky gut makes you more and more anxious, more and more insomniac. Okay? So if you have insomnia and anxiety, look at that leaky gut symptoms. Zonulin testing is a good way to understand if you have leaky gut. However, zonulin stool testing is kind of difficult. Not too many labs are doing it. If you can find a lab near you, you should definitely do it. There are some other tests which is known as the mannitol lactulose test. Again, it's not very accurate. Every lab has their own variation of it. And personally, I haven't found it very accurate in the testing of leaky gut. Lactulose per se, just by itself, is a better indicator of leaky gut than using the mannitol to lactulose ratio. Okay? So if you really must, you could use lactulose as a test for yourself. However, again, zonulin is the best marker. The simplest way that you can actually look at it is look at the symptoms. What are the symptoms again? Are you having frequent migraines? Are you having bloating and gas all the time? Are you having joint pains after waking up in the morning? Stiffness in your body after waking up in the morning? Are you having fatigue? Are you having insomnia? Are you having autoimmune disorders like Hashimoto's, or you're having thyroid issues, or you're having arthritis, which is not getting better? Are you having gluten sensitivities, milk sensitivities, animal protein makes you feel worse? All of these are definitely symptoms of leaky gut. If you're feeling better when you're fasting and you say, oh, my anxiety is decreased after I went to a resort and I only ate salads, you are definitely having leaky gut. Okay. And then the treatment, very simple. You just need to take curcumin without any piperine added to it and add some zinc gluconate to it. And at least you will start healing. If you can't do that, you can approach Amanda or you can approach Dr. Shamal and they can give you my Zinc, which will help you to do the same thing. If you're having hormonal disorders, there was a question of PMS, you can simply take my hormone folliculinum. It's a low dose form. So you had many cases where of doctors in the group where when their husbands were anxious or they were angry all the time, they gave the husband folliculinum, because when you give estrogen to a man, the man starts to calm down very nicely. So the same folliculinum which can be useful in a woman PMS, post menses in order to supplement the estrogen levels. In a man, it can actually dramatically decrease anxiety and stop the husband constantly fighting with the wife. So this is one more thing that you can do. If you're having hormonal deficiencies of endorphins, remember you'll have a very strong craving for spice and you will want to eat spice every day. Okay. If you're low in serotonin, remember the constipation, you will have the anxious depression. If you're low in dopamine, you'll have a complete lack of urge to do things. You'll be unmotivated all the time. If your nervous system, your SNS is very high, you'll have sweaty palms. Okay, you'll start to age very rapidly. So your hair on your head will start turning white very fast because you're having so much of high SNS activity. You'll have constant burping and bloating throughout the day. These are all symptoms that you can treat using that lycopodium remedy. Okay. We have some doctors who would like to share cases. So I'll give the floor to Amanda. Would you be able to introduce the doctors, Amanda?
Hi, Dr. Tariq and Dr. Sharma and everyone. Actually, we have two doctors. That we have a lot of doctors and a lot of health practitioners. But these two are willing to share some of their, personal case where they are really treated very well. Okay, first of all, I would like to call Dr. Z. Dr. Z, are you there? I'll call upon Dr. Z to share his case. Dr. Z, are you there? Hang on. Hi, Dr. Z. Just hang on. Maybe he's not right now. Okay, let me call upon Dr. N. Dr. N, would you like to start first? Dr. N?
I think we'll have to unmute them. You'll have to unmute them. Have you unmuted them?
Just hold on. Leo, can you unmute them? Just hold on. Oh, okay, Dr. Z. Dr.
Hey,
Z.
hi, can you hear me?
Yeah, loud and clear.
Oh my goodness. Oh, hi. Thank you so much for having me. How much time do I have?
Just share, just shoot.
Oh, okay.
Dr. Z.
So I'm coming under a pseudonym. Dr. Z is clearly not my name. I've been a student of Dr. Tariq since probably about when, Amanda? When did we start? Last year?
Last year, yeah, last year.
Yeah, so I'm 58 years old. I'm a full-fledged medical doctor. And for about the past 15 years, I've been an integrative medical doctor trying to find solutions for my patients apart from allopathic medicine. Not that I have anything against allopathic medicine, but sometimes it just doesn't work. And when Amanda said, hey, why don't you come and join Dr. Tariq's class? And I was like, oh, what's it about? And until now, I can tell you straightforward that Dr. Tariq's knowledge has changed me and my family personally. It has saved a lot of my own family members against COVID. However, this is not a topic about COVID. This is a topic about anxiety and depression. So one of the reasons I choose to come under a pseudonym, I don't want myself to be revealed. And this is going to be information that even Amanda and Dr. Tariq and my colleagues who might be here don't even know. So if you guys know me, please keep my confidentiality. When I entered medical school, I'm 58 years old, so you can imagine how long ago I entered medical school. I actually attempted suicide 3 times. All right, I had a lot of anxiety and depression, and it came and went throughout my career. And one of the things I know for a fact for me, I don't know about anybody else, when I took antidepressants, I actually got much worse. So that led me to seek other treatments, and I came upon integrative medicine. So I've been doing integrative medicine for about the past almost 20 years for my patients, and I find that I get very good results. However, that does not have anything much to do yet with today's lecture. So we come to today's lecture, and when Amanda told me some time ago, why don't you come and learn homeopathy and under Dr. Tariq, I said, okay. And when I started learning, I realized that I had some traits of a homeopathic preparation called lycopodium. Right. So personally, for me, lycopodium has been very, very helpful because I'm a very weepy person. So when you look at the homeopathic personality of lycopodium, lycopodium people are very weepy. So if I watch a movie that is much into an underdog, I start weeping. And once I realize what lycopodium is about, I realize I have a lycopodium personality. One of the personality traits of lycopodium is when somebody is under stress, they tend to treat family members not so good. They tend to treat other people outside the house much better than home family. And I realized that when I'm stressed, I have this tendency, and it's very, very stressful on my family. So when I took lycopodium, oh my goodness, my entire life, really, lycopodium has been a savior to me. My wife looked at me after a few weeks and said, you've changed. My patients. And so I have a few patients to share apart from my own. I would clearly say to you that lycopodium, at the right dosage, please go and see your practitioner. Yeah, don't just take it from here. I'm just sharing because it has helped my patients and me. But you know, if you are a practitioner, you have to take proper history. I had the history of lycopodium, and it has really turned my own family life around. I'm going to share a few more cases. I had a patient. She is actually in her 60s. So this wonderful person is a lady who has been stuck in a really, really bad marriage. And she is now 66 years old. And I actually asked her, why do you stay? Why do you stay in this marriage that is not doing you And she said, I'm very frightened. I said, look, you earn your own money, you've got your own studio, you're doing very well. Why do you still stay? She said, I'm very frightened. I'm very frightened about what society has to say about me. And so I started her off on lycopodium, 1M, and ignatia, very simple drugs. And she's already very progressive, so she's been off gluten for a long time. And within 1 or 2 weeks, her entire personality changed. And she came to me, she was smiling, she was laughing. I said, how are you doing? She said, I can't believe how well I feel. I said, are you still with this person, your husband, that you're doing? Yeah, I'm still there. I said, what's changed? She said, I don't really care about his reaction. I'm very happy in what I personally do. I said, I'm really glad to hear that. You see, she was very afraid to divorce because there was always, at 66, do you really want a divorce? It's a lot. You have to move out, your children, what will society say? She's very prominent in society, what will society say? And all of that. And she said, I'm very comfortable just staying in my own home. And my husband is there. And with the lycopodium and ignatia, she was already doing the diet change. So she was gluten-free and dairy-free for quite a long time. She's really enjoying her life. When you look at the big picture with this one person who's 66 years old, what are you going to do at 66? The husband's not friendly to you. Well, he's not violent, thank God, but he's not friendly. And she comes home, she goes up to her room, which is quite big because they're quite well to do. It's not a matter of finance. So she's got her own studio, her own room, her own bedroom upstairs. Now she says, it's really helped me to gel into my own feelings, and I'm liberated. I'm liberated from anxiety. I'm liberated from fear. I said, well, what do you feel about, a divorce? He said, it doesn't matter. He's sitting downstairs. He doesn't harm me. I'm certainly not going to look for another relationship, but he was hurting me before in my thoughts. Right? So before she came to see me, she was always hurt because he was there, sitting there, and they've been married for easily 50 years. He says, this man's been with me for 50 years and now he's becoming so aggressive verbally to me that every time I come home, it's a stab in my heart. That's why I can't divorce him, because we've been together for 50 years. But once I started taking the ignatia and the lycopodium, I can look at him and I can lead my own life. There's no more pain in my heart. The anguish is not there. So where I see this as a success is previously, before I would have met Dr. Tariq and attended his lectures, I would say, listen, why are you still there? This guy is mean to you. Why don't you just ask for a divorce? Divorce is at 66, it's very frightening for a lot of people, even if you're financially successful. She says, oh my God, I am financially successful. It's frightening, doc. It's frightening. So last time I saw her, which was early last week, I said, how are you doing? He says, I'm sleeping the sleep of the dead. I wake up early. I'm very enthusiastic about my day. I go to my studio full of energy and enthusiasm. She actually had to cancel a trip to UK because her husband came down with COVID. She said, do you know how, well, I knew, because before before COVID, she came to see me about preventing COVID, to go to the UK with Dr. Tariq's preparations. We won't go into that, but yes, Dr. Tariq has so many preparations. It's really assuring that, you know, there's so much treatment. So she came to me and said, look, I want some of Dr. Tariq's drops to go to the UK. I said, oh, I'm so happy for you. And then she came and said, oh, guess what? My husband came down with COVID and I can't go. And I'm so angry because, you know, the husband was never kind to her and now she has to take care of him, right? Do you know what I did? I told her, okay, so now that you have to treat him and give him water, why don't you put some lycopodium into his water? She actually did it. And this is very PNC, that's why I'm hiding under a pseudonym. You know, just with lycopodium 1M, their relationship has changed. He's looking at her as a human being and he's actually acknowledging her and saying, thank you. And oh my God, before attending Dr. Tariq's class, what do I have? As a general practitioner, what do I have? Xanax? Are you kidding me? Xanax? I would not prescribe Xanax to my worst enemy. I got another case. This is a lovely, lovely patient. She's 56 years old. And can you hear me? Amanda, are you there?
Yes, I'm here. Yes, I'm here, dear.
So far, I've been audible?
Yeah, very good.
Oh, this patient came to me and my goodness, she came with her husband and very, very lovely patient. And without any real, no, that's not true. What happened is her husband's business declined. They did not go into abject poverty. These are people that
Dr. Z, we lost you.
it really can you hear me now?
Yeah, we can hear you now.
I have to apologize. I have to apologize. I'm not in KL where my internet is very good. I'm running on my phone internet in Ipoh because I'm here in Ipoh because my dad fractured his hip, and you have no idea how much Dr. Tariq's anti-fracture drops has helped my dad. In 2 weeks of fracturing his hip, he can stand up. But that's a topic for another day. So this patient, she's a 56-year-old lady, and because of business, her husband's business, well, it didn't go into failure, but it went down. She had tremendous stress. She couldn't leave the house. And a kilometer away from her home, she sent me pictures so I know. It's a most amazing waterfall. So when I saw her, I did a lot of tests and I found that her ACTH was very low. And so she's not making enough cortisol. So again, very simple. I gave her a bit of sepia. I gave her a bit of lycopodium. I gave her a bit of ignatia because of the grief of the business loss. 7 to 10 days later, she was at the waterfall swimming. And until this day, that was in about December last year. With all the work, there was a lot of work. Of course, there was a lot of work. There was a lot of talking. There was a lot of convincing. The reason I'm sharing this case is, yes, of course, there's a lot of work. You don't just give the homeopathics and say, take this, off you go, you're going to be fine. No, you got to talk with the patient. But I did not use any allopathic medicine. not for myself where I shared, and not for this person, and not for the person who came before this. No allopathic medicine. So I have a few cases where I did not share anything except for homeopathic. I've got one more case to share. This was a 23-year-old Afghani refugee. Now, this is a lady, and she actually had to run away from Afghan because the family had arranged for somebody to marry her, and she says, no way. And you know what's happening with Afghanistan now, she would have lost her life. And so she came here, Malaysia, as a refuge, and she ended up with incredible anxiety and sadness. You would not, it is perfectly understandable. Your own mom and dad wanted you dead if you didn't marry this person, and you had to run from even your own parents. So you can imagine the amount of stress. I'm mentioning this because some may ask, how good are these therapies? Are they mild? Maybe they work for minor anxieties, minor insomnias. Let me tell you this is a real case. If you come to my clinic, I will show you the notes. This is a young lady who was forced to leave Afghan because her own parents would have killed her. And she came here with such anxiety and stress that she contemplated taking her own life. So when I saw her, I did an ACTH test, and hers was way below normal. Her cortisol was non-existent. Well, that tells me that she is mounting a stress response with adrenaline. If your ACTH is very, very low, this is basic biochemistry. If your ACTH is very low at the height of stress and your cortisol is very low, that means you are basically living your life on adrenaline. Now, adrenaline is not a comfortable molecule. Adrenaline is there to save your life against a death, a tiger attack. That's why it's there from more than 1 million years ago. So I asked her, do you have any, sense of thirst? And she said, I drink water at 8 o'clock at night. I said, what, from the morning you wake up? Why do you drink water at 8 o'clock at night? She said, I don't know. I just drink water at 8 o'clock at night. I said, don't you feel thirsty? And she said, she actually had to take time to think about it, thirst. And I said, do you drink because you're thirsty, or do you drink because you feel you have to drink some water? She said, I drink water after dinner because I think I need to drink some water. So you don't feel thirst the whole day. And she had to actually think about it. She said, no, I had to tell her, the difference. You drink because you feel thirsty, or you drink because you have to drink water, but you don't feel thirsty. And she finally said, I don't feel thirsty. So I gave her some pulsatilla, I gave her some ignatia for the grief, and I gave her some lycopodium. That's the magic. That's all I did. Three simple homeopathics. I said, come and see me in a week's time. 1 week later, she came back, she brought a friend. She was laughing. She was literally laughing and joking, and she said, please help my friend. Oh, we did some blood tests. His ACTH was also low, cortisol was also low. We gave him the same treatment. He came back laughing in a week's time. Now, these are genuine cases. I have the case notes. I have the lab tests. If anybody wants to see the ACTH and cortisol levels, all futures, we have all of this. All right. So I'm sharing here anonymous because I want to share my own family, my own self. My mom is on acid, on lycopodium. My dad is on lycopodium. My sisters are on lycopodium. What can I tell you? It is the most amazing thing. Lycopodium in the right person. Once you do the homework, you know, there's a lot of homework in homeopathy. It's not simple. Gives back patients their life, because your life is led minute by minute. If every single minute you live is a misery, you will end up with 50, 60, 70, 80 years of misery. But if every moment that you look around is a mystery and a joy, you look at the world around you and everything is like, oh my God. So you're looking at the world from a parasympathetic state. My God, the difference between looking at the world from a parasympathetic state compared to a sympathetic state where everything is fight or flight and fearful. This person's out to get me, that person's out to get me. And with lycopodium, you're looking around and say, such peace, such calm. And those who meditate, I'm sure there are a lot of here people who meditate. If you wake up in the morning in pure darkness and you take 4 drops of lycopodium 1 mg, please get it approved from your homeopathic doctor, and then 10 or 15 minutes later you go and do your usual meditation. The depth of your meditation in a purely parasympathetic state cannot be matched by anything else I have ever experienced. You may experience other things that will help you there. I've experienced a lot. Nothing beats the meditation at 5:30 in the morning with 4 drops of lycopodium 1 mg inside of you, and then you meditate. And you come out half an hour later of the meditation and you tell me the world has not changed for you to be a blessed place, a peaceful, wonderful, blessed place. You start your day from there and miracles happen. Thank you for letting me share. I hope I've not gone over time.
Thank you, Dr. Z, for such a marvelous and wonderful case sharing. You are always dearly and always close to my heart. You are such a wonderful person. Thank you for sharing here.
Thank you, Amanda. I will now mute myself.
Okay, all right. Okay, now I call upon another wonderful health practitioner. He's also very nice. We call upon Dr. N. Dr. N, are you around, dear?
Hi, Amanda.
Yeah.
Can you hear me?
Yes, we all can hear you. Please continue.
Thanks for that. Yes, I truly enjoy Dr. Tariq's courses, and I've started a bit later than the rest. I started in October last year, and so I had a lot to catch up, but it's been a very interesting journey. And like Dr. Z, I'm also an integrative functional doctor who's been practicing for roughly 15, 16 years like him. And then I enjoy what I do, but you know, with integrative and functional, sometimes treatments can be costly. So for the patient's sake, sometimes we try to look for alternatives that would, you know, be a bit easier on their pocket, but at the same time give the kind of treatment, the kind of success. And I found it with this Dr. Tariq's homeopathics and low-dose precision medicine. It's been amazing for my practice, and I've seen remarkable results. And I really recommend this to anybody. And the knowledge that Dr. Tariq has, oh my God, it's just so profound. And just like I echo Dr. Z when he mentioned about that. Okay, so quickly to my patient. I have a few patients that I'd like to just share. Patient A is a 63-year-old female judge, very high flying and very successful. Outwardly, you can see that she's professionally, you know, she's at that top of her career. People are so respectful of her. She's powerful in her court. But inwardly, she says to me, you don't know what I feel inside. I'm full of anxiety. I'm full of worry. And her main problem stems from her not being able to sleep well for the last 30 years. She has this very chronic insomnia, anxiety, and depression running in the family. She's been on Xanax, used to be on 0.25 milligram, now on 0.5. And then she's on melatonin. She still wakes up at 4 a.m. She's also on GABA twice a day, lavender oils, you name it. She's on anything. It started when she lost her brother many, many years ago when she was 20 and he was 26. She lost her brother in a tragic air crash. It affected her really badly. She was very, very close to him. So she was given tranquilizers then and antidepressants and didn't seem to work. And she was then sent abroad to UK. In UK, she lost her cousin in a car accident, whom she was very close to. So again, that affected her badly. She lost her father in her 50s, which put her into a depression. And at present, she worries about her family. She worries about her husband a lot because he's her hero. But she doesn't realize she's actually the anchor of the family, the strength of the family. Her husband has some health issues himself, and she worries so much about him. She can sacrifice herself for his sake. She would wake up in the middle of the night with the slightest noise, being startled, and calls on him to make sure that he's okay, because she's so easily startled and gets into a fright if anything were to happen to him. Initially, without all the homeopathics, in let's say a year or 2 years ago, all I could do was, okay, give her melatonin, give her GABA, give her magnesium, progesterone, or what, DHEA, just to boost up her adrenals and to take care of her strength. But then this year, I started her on causticum. I thought I will start with something to help her with her sleep. I just gave her causticum because I read that it helps with your sleep-wake cycle, the biorhythm, biological clock, by activating the supranuclei of for sleep, right? So I gave her 4 drops at night, and the lively, smart, and delightful. She was a bit worried about that at first, so she only took 5 drops. And the next few days, when she texted me, she said, Doc, whatever you gave me, it's amazing. The sleep drops you gave me is amazing. And she calls it the magic potion. And after a month, I started something else on it. I added Calicarb to see if it could reduce her anxiety further. So because she was also waking up to go to pee at night. And then after this Calicarb, she finds that she's less waking up at night. She's less frightful, with less stress, and sleeping is so much better. Now she's even able to go on holidays. Just came back from Spain. She comes back with a renewed vigor. She says now she's no longer, because I told her, you know, when you're taking this lively, smart, delightful, which is a precision low dose medicine Dr. Tariq has, is a particular cytokine, told her to place an intent on it. Make an intent before you use it. Intent for yourself to feel good about yourself, to feel better, and whatever you desire, you know, place that intention. So, and in her life, she has been bullied so much by her in-laws. So when she did this, she said she changed. She's become a tigress. So she now fights for herself now, no longer just about for her family, because before this, she was the sacrificial martyr. She would give up all her position and rights just for her husband, her children. But now she fights for herself. And I'm so proud of that. And most recently, I've just added NACMA to her because I want her to get over her grief, this long-term grief that she's had. Maybe it's still residual in her, even though it's like been 30 over years, 85 over years. I don't know, it could still be residual. So I'm trying it out and let's see what her results come back as. So that's my first case. My next case, this lady, she's a 59-year-old female, married with kids, in a quite comfortable background as well. Husband is quite a successful businessman. Yeah, they have it all, it seems, you know. But she's also very anxious and depressed. Her mom passed away about 4 or 5 years ago, and she was very, very attached to the mom. Hence, it impacted her badly. Especially since she's not so close with her dad. Her dad bullies her. Her mother used to be like her ally, but now she feels like she's on her own. She gets teary every time thinking of her mom. She cries a lot, and then she takes it out on her husband. She used to be able to control herself, but now not anymore. And she could not sleep at all, waking up in the middle of the night, anxious, afraid of loud noises. Her husband really has to tiptoe around her, or he will work downstairs, but when he comes back up, she will be aroused. So she is easily aroused. And then she wakes up to pee at 3 a.m., easily startled. And of course, in the morning, she gets fatigued, right? Her issue with her dad is that he's too authoritative. He has a strong financial position, and it's as if like she has to serve him, wait on him, cooks on him. He's abusive. He has almost like a narcissistic personality. And if ever he sees her hurt or tearing up, he will actually smile and appear that he's enjoyed seeing her reacting. Cleanliness. Can you hear me?
Yeah, Dr. N, we can hear you.
Okay. Yeah. Okay, so all this, I started her on initially Netmar, Staffy, and Sapia. And just with that, she managed to get some really deep sleep. The grief was better. She rarely gets triggered by her father anymore. And then I told her, perhaps give something to your father as well, because you never know, right? So I gave her this lively, smart, delightful, and told her, perhaps put a few drops into your father's water and see what happens. And guess what? He really, his personality kind of changed towards her. He became a bit more friendlier towards her. And she said he's calmer. So she was really happy with that. I even added some Calicap and Causticum, and she has such good sleep now. Deep sleep, wakes up not tired, happier, no more anxiety. I have all her text messages to say that. And no depression too. So the third patient is a 45 years old. She had a death in the family about a year ago. Her brother passed away suddenly due to a heart attack. And she was here in Malaysia while he was in Indonesia. She's Indonesian. So it took her quite some time to recover because not seeing the brother, and they were very close and being apart, you know, and that really affected her. So when I used to see her here in KL, and I would see she's like, sometimes she has crying bouts. We just talk over coffees, and she'll say, oh, she's unable to sleep, thinking of him a lot from time to time. And suddenly this year, when she was on holidays in the Netherlands, she was visiting her son there. Her father, who's in Jakarta, also passed away unexpectedly. He appears to be healthy, so it was really so unexpected, and he was alone at that time in the home, so no one knew the exact chronology, except that they suspected it could be internal bleeding, because he was on a lot of painkillers for his gout. Now this left her really traumatized. As she was in Netherlands, imagine she had to arrange a flight quickly back to Jakarta, trying en route via Singapore, and then had to try to appeal for exemption from the quarantine, and then arrange the funeral with her sister, attend to the mother. Oh my God, she was really, really stressed, and she was under a lot of issue. So when she arrived back in KL, after all that funeral was sorted and she had attended to all the family matters, I told her, why don't we try some Ignatia? And just to kind of help you overcome all this. And we did. I gave her some Ignatia. And in a few days, she said, this is amazing. She has better sleep, less anxiety. She was able to kind of perk herself up and enjoy some moments in life, and even reached out to her mother to come over to Malaysia, come for a holiday. In fact, they just went to Bali and brought back her mom into Malaysia, and took her mom dancing and dinners and some medical checkups, etc. So she's able to come out of that, which was barely about a month ago, the passing of her father. So she was able to come out of it quite quickly, quite effectively, and it gives her now productivity because she's able to handle her family, handle herself. So these medications, which previously before with our allopathic drugs, what we could do, like Dr. Z said, only give Xanax. I would not give Xanax. What could we do? So you couldn't give anything, and it would have left a lot of people in misery or in a rut, not being able to get out of that rut. And having these medications is like a boon. And the way it's being taught by Dr. Tariq is that you can match it to allopathic investigations. It's very scientifically based. So you can literally go by blood tests, like Dr. Z has mentioned. You can track them with your blood test, and you can see a biochemical response. So it's literally, it's formulaic. There's an algorithm. That's why I like so much about this. Thanks, Amanda. I hope that's a little bit of sharing that might be useful for the rest.
Thank you,
Dr.
Dr.
Yeah.
Yeah, thank you, Tariq, and such a wonderful sharing. Dr. Tariq, my dear, Dr. Tariq, our very, very great teacher. Anything to say before I say take over?
Yeah, so I did see that there are a lot of questions in the chat box. I have answered the Q&A questions. Most of them I have answered them personally, but I'm sure that you guys may need further consultation. So please consult Amanda or Dr. Shamal. We can find you a practitioner in your local area. The other thing I wanted to say that these little magic drops, they actually curative. So you don't have to take them your entire life. At times, the treatment can simply be, maybe a week or 2 weeks of dosing, and that's enough to completely cure the patient. So, you don't have to take them lifelong. Even if you are on alprazolam or any of these drugs, it's very easy to get you off them as you take these other ones. I recollect a patient we had who was having uncontrolled blood sugar. So she called me for that actually. She said, my blood sugars are going higher and higher every month. What do I do? So when I looked at all the other drugs she was taking a whole bunch of alprazolam. And one of the side effects of alprazolam is it increases blood sugar levels. It makes you diabetic. So this was a major cause of it. The other thing she was taking is she was taking a beta blocker. Again, beta blockers can cause you diabetes. Third thing she was doing is she was taking a statin, which was making her blood sugar also go up and causing her muscle weakness. So as we started to treat her, I did not give her anything for the diabetes. All I did was to decrease her stress levels. And what she explained is that she works in a bank, and whenever the notes come for counting, when she's hurried, she develops acute stress and she gets a panic attack. So I simply treated in the same way that the two doctors here have mentioned. I gave her some sepia, because she was clearly having low levels of serotonin. I gave her sepia, I gave her lycopodium because she was panicking, having palpitations, her whole body was trembling. I gave her califos because whenever she would be tired, she would not be able to sleep well. So just with these three medicines over a period of a month, we were able to stop the alprazolam and the beta blocker both together. And that resulted in her blood sugar becoming completely normal. And she now has a completely normal blood pressure. So these are the side effects of the allopathic drugs. They don't actually have to cure your problem, or they don't create a new perspective that Dr. Z was talking about, where you can actually develop a new perspective or insight in your life. They just have to suppress and block things out. So you end up still being the same miserable person, having the same level of anxiety, I'll bet just a little bit edited with the drugs. And that's the life-changing experience that you can actually have with these medicines. So, okay, let's